Namaskar and welcome to Sansad Television. I am Vishal Dahiya and you're watching our show Perspective, where we bring you detailed analysis of key national and international issues as well. Today we're going to talk about the immunization process or the vaccination. Now, immunization is a health and development success story. In fact, in India, expanded program on immunization was launched in 1978. It was renamed as Universal Immunization Programme in 1985 when its reach was expanded beyond the urban areas. Now, the Universal Immunization Programme, or UIP, is one of the largest and most cost-effective public health interventions, which is largely responsible for reduction of vaccine preventable under 5 mortality rate. Two major milestones of UIP have been the elimination of polio in 2014 and maternal and neonatal tetanus elimination in 2015. Mission Indradhanush later was launched in December 2014, and this aims at increasing the full immunization coverage to children up to 90%. Now, COVID pandemic led to slight reduction in immunization coverage in 2020-21 as compared to 2019-20. However, a number of steps were taken by the government for strengthening routine immunization amidst the ongoing COVID-19 pandemic crisis. COVID vaccination program launched in January last year has also been running successfully. So today in Perspective, we will try and understand a bit more about the achievements so far of the immunization program, as well as the challenges which we face and how those challenges can be tackled. And for more on this, we're joined by a distinguished panel of experts. Let me first introduce them to you. Beginning with, we have with us Dr. Sunila Garg, who's joining us. She is the chair of the Program Advisory Committee in NHW and Professor of Excellence in Community Medicine as well. Dr. Raman R. Gangakherkar is also with us. Dr. C.G. Pandit, National Chair at ICMR, and Dr. Lekha D. Bhatt from the Department of Epidemiology and Public Health in the School of Life Sciences at University of Tamil Nadu is also joining us. Welcome all of you to Sansad Television. Let me begin with you, Dr. Gangakherkar, and let's start by understanding the scope of the topic which we are looking at, the immunization program. I mentioned certain, facts which give us an idea about the journey. But if you could take us a little bit deeper into this journey of immunization program and a bit more about the achievements, how did they come about?
I think if we look back retrospectively, perhaps it's one of the most successful program that has ever been being continued throughout, in the world itself. One has also got to understand that in India we provide vaccines free of cost. Not many countries, even among developed countries, they provide vaccines free of cost, even at this point in time. The result is these vaccines tend to prevent. So far now we have 9 different diseases against which we have covered these particular vaccines, with which perhaps we are able to reduce not only morbidity but also the mortality that could arise due to it. And 3 more vaccines are also introduced, which are given in different geographical areas as of now. Perhaps they will be scaled up rapidly in few years to come. And at the same time, one must not forget that COVID vaccination program prevented so much of mortality that actually could have had occurred. And the bigger challenge with COVID vaccination was this was an adult vaccination program, which hitherto we had not used. We had done that only in case of pregnant women. When we were providing tetanus to these women and the TD vaccine that subsequently was being provided. So essentially, if you look at it, it has contributed immensely in terms of gain in lifespan or the days that we have perhaps saved because of this immunization program. Though India is a very large country, perhaps nowhere in the world you have such a large infrastructure which can provide these many vaccine dosages to everybody in a country like India. You imagine the situation when we say that we generally tend to provide close to about 2 crore to 70 lakh children with these vaccinations, and the same number tends to also exist for their mothers, because during pregnancy you provide these dosages to them.
Indeed.
It's a massive program. it's a program that we are doing free of cost. So if it has contributed immensely, perhaps to the lifespan, the results are very much seen at this point in time. And in COVID, we have proved far beyond, because even the challenge of providing vaccines to the adults was handled really well.
Indeed.
So in short, I would say that our program implementation has been one of the best. We have the largest infrastructure. There would be certain additionalities that we could bring in to improve the survival or prevent certain other diseases as well. The challenge of COVID perhaps has affected some proportion of children who may not have had received vaccines during this particular period. We may have to overcome that.
Okay. We'll talk about those aspects as well, which need to be taken into consideration. But there you're right, Dr. Ganga Kherkar, that the entire COVID vaccination program has been a resounding success, and it has been built upon the existing infrastructure or the existing, system which was in place for the immunization via UIP and Mission Indradhanush as well. Dr. Garg, I'd like to bring you in here, in terms of achievements, of course, but also in terms of what are the new areas, new emerging areas when we're talking about the immunization program?
First of all, it's a very, very important question. Let me say that this program is directly under Pragati initiative. That means proactive governance and timely implementation. So this is directly under the supervision of our Honorable Prime Minister. So this is being followed by that. Another thing is that as we have been, going ahead in the journey, I was a young graduate in 1978 when our expanded program of immunization came in. And, gradually newer and newer vaccines came in, and we have got progress in terms of, looking at the disease burden and also, the newer initiatives. We have got new vaccines as well. So as Dr. Ganga Kherkar already mentioned that we have got, 9 compulsory vaccines, and then we have got 3 additional vaccines also. But we are also looking at, that modification of the vaccines as per. Like when we have got, the injectable polio vaccine, which is a kill vaccine, then we may move from trivalent to bivalent vaccine. And also then we have got, rotavirus vaccine, which is now being, introduced into different states. And from MMR, we have moved to MR vaccine because you see, we have realized also the cost effectiveness also, and we need to focus upon the congenital rubella syndrome also, which is responsible for 2 to 3, congenitally hearing impaired children. That is important part of it. And then also pneumococcal conjugate vaccine and plus tetanus and diphtheria. Earlier, which was known as very commonly, each one of us has had tetanus toxoid vaccine, but we saw that number of cases of diphtheria are increasing. So we have converted into a TD vaccine. Another important, initiative which has been, integral part of this vaccination program is the digitalization of the whole vaccination program. That means we have got now electronic vaccine intelligence network. Basically that tells us, sitting in Delhi, because when I'm looking at NIHW and I'm looking after all the programs, and one of the important programs is also immunization program, and where, the NTG is also there, and we are monitoring the cold chain, and now 11 states are there, which you can directly monitor sitting at NIHW, and, very soon we are going to add 10 more states. That means sitting in NIHW, we can see that how much, at the sub-district level, how much is the stock of the vaccine, what is the cold chain of the vaccine and all that. And now the newer initiatives which are under consideration are also, because we are looking at the barriers and challenges. That means, there is a lot of electricity fluctuation and all that. So we are looking at the solar-based, our cold chain appliances, and also appliances. Suppose you take out the vaccine, that will immediately show that, how much doses are left. If you put back, those number of whatever are the remaining number of doses, it will tell us the exact amount. So that is important. Another important point, which, Dr. Ganga Kherkar also mentioned regarding the COVID, and you also mentioned about this COVID-19 vaccination. What we realized is our country is huge. There is huge diversity. People have to carry huge, the heavy vaccine carriers. So there is also improvisation in terms of how we can make the vaccine carriers lighter. And also, there is digitalization of that also. So within that also, we can monitor the temperature. So that is another important thing what we are doing.
Okay.
So it's a combination of advanced technology. It's
Indeed.
a combination of keeping into consideration the newer diseases. Like we do have Hpv vaccine, which is being administered through the private sector. It has not become a part of the national program. That is important. We have to look at even in private sector, we are administering, chickenpox vaccine as well. And our pediatricians are the major providers of these vaccines. But then looking at the public health perspective, gradually these programs are roped into our national health initiatives also.
Okay. Okay.
Now moving from and taking leads from this and taking leads from COVID, now we have started discussing also about, the adult immunizations also.
Okay, we'll come to adult immunization part there as well. Dr. Garg, I'd like to ask you to hold your thoughts there on the adult immunization program, because that's going to be really important and significant vis-a-vis what we have achieved in the COVID immunization process here in the past year almost, less than a year and a half. Dr. Lekha, but I'd like to bring you in here. In these two aspects which Dr. Garg was referring to, vis-a-vis the use of technology, advanced technology, to further improve the way we run our immunization program in terms of monitoring, in terms of supply chain management as well, and the new vaccines also. So these are certain key areas. Apart from that, any emerging areas which you would like to add on, and specifically on these aspects, how are we moving ahead?
Yes, digitalization that is happening in this field, and the management of cold chain, improvement in the technology that is coming up, these all are very effective interventions and upgradation that is happening in this program. And taking the lessons from COVID immunization, COVID vaccination, how can we increase our reach further and ensure that we are able to cover all the children as well as other vaccination that are provided to adults as of now, how to increase the coverage to maximize, that is the focus of the time. And there is still, we do have gaps between the coverage, the reported coverage and the estimated coverage. So how to address this and how to improve the surveillance further, that will be an important area that we have to focus upon.
Okay.
And till now our vaccination is focusing on under 5 children. And we are able to bring down mortality rates and morbidity rates, as Professor Raman was mentioning, to a considerable level. And our interventions are now at par with the developed country interventions. So maybe we'll be able to move further to a life course immunization, what WHO is suggesting. So maybe that aspect we can bring in to more detail.
Okay.
And start some implementation, developing programs and interventions at that level will be interesting.
Okay.
And some of the vaccines now available are optional, as Professor Garg was mentioning, chickenpox vaccine, then Hpv, so certain vaccination for adolescent girls. Certain things are now optional. So is there a possibility to integrate those or as those vaccination also into the Universal Immunization Program?
Okay.
These are the other aspects we'll be able to.
Okay. Those are very interesting and important aspects there as well. I'd like to bring you in here, Dr. Ganga Khedkar, on these two things, which both our panelists, Dr. Bhatt and Dr. Garg, are referring to, vis-a-vis use of advanced technology, as I was pointing out earlier, and as Dr. Bhatt is pointing out, certain other aspects which we need to look at when we want to further improve and enhance the efficacy of our immunization program.
Yeah, I think when it comes to digitalization, as you talked about, perhaps that's one important component which can be done from the central level. But I am a strong believer in mobilization of the communities. Now, what is more important is and a challenging task, because unless you mobilize the community, people will not accept those vaccines. People may not come on time to take these vaccines, which we have seen in large number of vaccine delivery programs. Especially, there are certain religious groups which do not allow vaccines to be given to children. Now it is time, if we want to enhance our coverage, we not only focus on digitalization, which is far simpler to be done, but at the same time, we have to focus on community mobilization so that those preventable diseases can perhaps be eliminated to a larger degree. They may not have elimination goals. Majority of these diseases don't have elimination goals as of now. But why can't we aspire to develop ones? That's something which we have to keep at the back of mind.
Okay.
And the second thing which I feel is, it is time now we have to look at, certain vaccines. One vaccine which Dr. Sunila Garg referred to was HPV vaccine, because it can reduce the incidence of cancer of cervix, and that's a tool which is already being used. Now we need to think ahead. If this is going to improve women's health, now can I include it in the program? Is an issue which we need to think about at this juncture. I would also say that vaccines now, perhaps, in a shorter period of time, since you find that for COVID, some of the kits that are coming up are multiplex PCR kits. So we will know about respiratory syncytial virus prevalence also among children, the incidence of RSV. Now, if we know about it, there are vaccines which are being currently developed, because when we provide vaccines, the diseases which can cause morbidity and mortality may be prevented, but there would be a replacement from other infections which will also have to be considered all through.
Okay.
And the last thing which I feel, that it is time, when we are passing through this COVID pandemic, people have suddenly become aware of influenza. Can we at least have a good communication package to talk to people that influenza vaccine should be taken by elderly in order to reduce the risk of death that could occur among adults, because this is the best opportunity that we have at this juncture. And the last thing which I feel is vaccines, adult vaccination, or even vaccination in children, those people who have immunodeficiency, whether it is HIV-infected adult. Now, do we not need to cover them with different vaccines is a question which we need to think about and include is in those specialized population, because it can also reduce morbidity to a larger extent.
Okay. Those are really important aspects which need to be looked at. I'd like to bring you back here, Dr. Sunila Garg. You were earlier referring to adult vaccination program as well, and the community mobilization part, or the involvement of the community, becomes significant in both aspects, the adult vaccine process as well as the vaccination of children also. So one, how do we move ahead on that? And communication is the key here, as Dr. Ganga Khedkar was referring to.
I think community engagement or community mobilization is the key component of any program. You see, whether we talked about, now we are talking of, with respect to COVID-19 vaccination. And I think I could agree no less with Dr. Ganga Khedkar. As I said, we have seen this expanded program of immunization to UIP, to, Safe Mother, Safe Childhood program and all that. So moving ahead, we saw all the stages. An initial response of the public is that, since we were dealing with a childhood vaccine, so, it was so important to take communities into consideration that, vaccines are safe for the children, because their perception is children are absolutely
and we've seen this challenge being overcome, this challenge being overcome during the COVID vaccination process as well. When you're talking about the adult vaccination program, a huge communication program was launched, and people were told that yes, this is important, and then finally it was accepted by the community as well. We've seen the results.
Absolutely. That's how, because it is important to mobilize the community. So that's how we developed a communication channel or communication program, right from the national level to the state level to the district level. So, and it is still going on. We have not lost sight of that. So we are going continuously ahead with that, because you see, when newer and newer vaccines are, or rather we are going ahead with the, younger age groups. You see, there are a lot of challenges also. We say that people come forward easily. So it is important to look that we do not lose a sight of the community at any stage. We have to involve, whether we talk of Panchayati Raj institutions or our Gram Sabhas or our resident welfare associations, we have to move hand in hand, because
Okay.
no program can be successful unless there is a support of the community. And when we launch the newer vaccines also, it becomes important not only that we have launched the vaccine, it is important also to sensitize them. And then another thing is that we are regularly doing evaluation of our programs, how much percentage we have covered and all that. We are also paying attention to which are the low covered states and all that in terms of the districts. So that's how we are strengthening our immunization program. Since the coverage was low in substantial number of districts, I'm talking of the year in early 2008 and all that, that's how it came directly under Pragati initiative, and upfront leadership was taken up by the Prime Minister. So we are now directly monitoring the program at the district level, and with the support of communities only we can move forward with regard to any program, which is, whether we talk of the, immunization program or any public health program now when we talk of TB elimination and all that. But we definitely, one of the important things is we have to move forward. COVID has shown a direction that it is important to consider your elderlies. That is important, so that, we look towards immunizing them with flu vaccine or we talk of pneumococcal vaccine.
Indeed.
So, but then we have to make them affordable, accessible, so that people come forward and take the vaccines also. Because we have a huge chunk of elderly population to the tune of about 9% now, and which will be substantially increasing by the year, 2050.
Okay. Indeed, expanding the scope of the entire vaccination program there. And quick concluding comment from you, Dr. Bhatt, on this community mobilization aspect. This becomes really important. We've been having this discussion, during the COVID pandemic. All of you have been on our shows. We've spoken about how it's really important for the community to be involved and mobilized, understand the importance of the vaccination process.
Community mobilization and engaging with community is very important for success of any program, especially when our target group is under 5 children, getting the consent of the parents, and they are the people who have to bring the children for immunization. So involvement of community, other stakeholders is very important. And we could see it with the work of ASHA workers. When the representative from the same communities were involved and their interaction with the community was more, the results were far better. So engaging with community at different levels, let it be schools, let it be community leaders, elected representatives, other stakeholders in the community, that becomes very important. And now due to internet availability in rural areas also, social media usage and in other platforms, social media related platforms use has increased even amongst the rural population. So we can channelize and use these new platforms to reach out to the public and improve the vaccination and immunization in the country.
Okay. So there it is. Thank you so much, Dr. Lekha Bhatt, Dr. Raman Gangakhedkar, and Dr. Sunila Garg as well for sharing your views and insight. As our experts were pointing out, of course, the immunization program in our country has been a resounding success. We have had a lot of achievements, but of course, when we move ahead with the times, there are challenges, and those challenges are being identified, as our experts were pointing out, and more specifically, ways to go ahead and tackle those challenges as well. Use of advanced technology is one of the key areas to tackle these challenges, but so is involving community and community mobilization as well, making people realize that yes, vaccination or immunization is very important and very significant and helpful to them and their children as well. We'll come back again with a different topic. Till then, keep watching Sansad Television. Thank you.